Assessing the clinically meaningful benefit of a medication, if any, is a great way to decide whether or not you should take it. In this edition of Pharmacy Pearls, I'll explain why this is so. Let's begin by considering this hypothetical example involving a 60-year-old man with high cholesterol. In order to determine his risk for heart disease, we'll presume that he is a non-smoker, does not have diabetes, has normal blood pressure, and no family history of early heart disease. In this case, his 10-year risk of dying from heart disease or suffering a non-fatal heart attack or a stroke is 11%. Note that his risk is 6% higher because of his elevated cholesterol levels. Now let's suppose that he gets treatment with a high-dose statin medication, which lowers cholesterol. In this scenario, his 10-year risk will decrease to 7%. Stated differently, for every 26 men with a similar baseline risk, high-dose statin medication will result in one less event over the course of 10 years. Importantly, this potential benefit must also be weighed against the potential harms of treatment, including cost and side effects, in deciding whether or not to take it. On the other hand, let's suppose that our patient decides to take ezetimibe, another medication that lowers cholesterol. In this situation, his 10-year risk will remain unchanged. That's right, despite lowering cholesterol, taking ezetimibe will have no clinically meaningful impact whatsoever over the course of 10 years. Meanwhile, it will be associated with several significant harms. Bottom line, a medication's impact on a surrogate marker often has nothing to do with any clinically meaningful benefit. If such is indeed the case, why bother taking it in the first place? In order to assess the clinically meaningful benefit of a medication, ask your prescriber or pharmacist. Thanks for watching. In order to receive my free weekly tip, visit www.pharmacypearls.com. Please also show your support for Pharmacy Pearls by subscribing to my YouTube channel.